over 20 years ago, attempted to take my life. I had been suffering severe depression for quite some time, and suicide felt to me at that time that it was an option. And 4.5 years ago, I lost also my brother to suicide. So it's impacted our family, greatly. And now my passion and purpose is very much suicide prevention. My experience of the healthcare system and the mental health care system over 20 years ago was a reasonably negative one, to be honest, which is one of the reasons that I like working in that sector myself now. And I guess I really tried my hardest to find support within that area, and didn't connect with a therapist and didn't connect with the clinician. Definitely lacking was the connection with somebody that had gone through something similar. Still was left to feel that you were isolated within your thoughts. There was a lot of stigma attached to it, shame, blame, fear. So within that, I still remained feeling isolated and very much a patient, not a person, and quite disconnected. When you're thinking about suicide as an option, it's a very isolated space, and it's a very alone space. And reaching out to the doctors or reaching out to therapists is what we've been taught to do and told that that's where we can get help, which is what I did do. However, I was still left feeling alone and isolated, and that tablets, pills, would change the way I was thinking and feeling, and that didn't happen. So, yes, I struggled within the health system, to be quite honest. It's not the doctor's fault. Like, they're doing the job that they've been trained to do, and they were doing exactly what they knew to do. When I started working as an aftercare support coordinator within a mental health clinic, the clinicians themselves really were not understanding of what lived experience can bring to those roles. I was fortunate enough to have a voice as a person that is now working within the mental health sector, having had the lived experience of suicidal thoughts and an attempt myself, and then having lost my brother. I was able to and was asked to be on a clinical governance group, and I was given a voice, thankfully, to be able to share how important it is to have that lived experience and to be able to help educate in that perspective rather than in a clinical perspective. Leadership is extremely important with a lived experience perspective, as well as the training around the research that has continued to evolve over the years. It took a little while for the clinicians to understand that the lived experience that I had was of value to our clinic. Fortunately, I ended up having a great deal of respect and value, to the point where if a client did present with suicidal thoughts with one of the other clinicians, they would engage me within that session, come and ask me if I'd have a chat to the client, and that became part of our process. Very quickly they saw the value that added to the client. The value was, again, that the client wasn't alone in their thinking. I would share with them that I had been in that space, that I understood what it felt like to be in that dark space. I understood what it felt like to feel alone, isolated, the shame, the fear, and because of that, they were able to start to share their story rather than keeping it to themselves. Although I have a therapeutic background, I don't work from that perspective. I work from the perspective of lived experience. Do you understand what lived experience is? If they didn't, I would explain to them that I myself have been in this position as you have, that I have also been suicidal over the years, many years ago, suffered severe depression, and that I'd lost my brother to suicide. And straight away, we would jump that, tell me about yourself, what have you been feeling, what have you been thinking, all those sorts of things. We straight away had that connection and that empathy, and the client would feel safe to talk to me because they know that I've already been in that position myself as well. I will sit and talk with somebody and look them in the eye, and I will talk to them like I'm talking to a friend. I actually won't fill out my paperwork in front of them. Quite often that's been noticed and spoken about by a client and has said to me, thank you so much for not sitting and typing at your computer or writing. The passion that I feel around this is due to I know that it works, and the reason I know that it works is because I have been working with people within this space now for a long time, and I haven't seen any evidence to show any different, that empathy and connection is not working. Within a 2-year space, I worked with over 350 clients, and I didn't lose any within that time that I was working with them. There is evidence there that for somebody like myself that can sit in that space with them, not be thrown by judgment, or if they share a part of their story that they haven't shared with anybody before, that there's no judgment, there's no stigma, there's no I don't react, and then that secret that they've been keeping that they may not have shared with a clinician is shared with me because I understand it. The impact that it has on a person when they're in that space is that they feel valued and they don't feel alone, and that decreases that fear, I think, around those thoughts, and decreases the fear around the shame and the blame and, again, the isolation and the aloneness. The Zero Suicide framework within the healthcare system is now encouraging doctors, mental health professionals, peer support workers to take into consideration, and with the training of that empathy and that connection, to decrease the isolation and that aloneness that people feel when they're having thoughts of suicide.